Today, we are going to look at a BodyViz brain builder about pulmonary alveoli and gas exchange. Gas exchange is the movement of oxygen from the alveoli within the lungs into the cardiovascular system and carbon dioxide from the cardiovascular system into the alveoli. In this brain builder, we will discuss the anatomy of the respiratory pathways within the lung, the alveoli, and how gas exchange takes place. Then, a patient example will explain the effects of a reduction in gas exchange due to emphysema. The respiratory system is divided into conducting and exchange pathways, and the unique structures of each allow for different functions in the process of respiration. The structure of the conducting pathways are not anatomically designed for gas exchange. Instead, they condition inhaled air, which includes warming, cleaning, and moistening the air. The structures of the conducting pathways include nasal cavities, pharynx, larynx, trachea, bronchi, terminal bronchioles. The exchange portion of the respiratory system is anatomically designed for gas exchange and begins with the respiratory bronchioles of the lungs. This is the first level where alveoli make their appearance within the respiratory system. Alveoli are anatomical structures whose physical attributes and high vascularity make them specialized for gas exchange. 3 types of cells are found within the alveoli. Pneumocyte type 1 cells, which are also called squamous alveolar cells or septal cells, make up approximately 95% of the alveolar surface. These cells are squamish in shape and form the simple squamous epithelial wall of the alveolus. This epithelial wall provides a very thin diffusion barrier between the alveolus and the capillaries of the pulmonary vascular system, allowing for the fast diffusion of gases. Pneumocyte type 2 cells, also known as great alveolar cells, make up approximately 5% of the alveolar surface. These cells are cuboidal in shape and produce surfactant, a phospholipid that reduces the surface tension of the alveolar walls. Less surface tension means less pressure is required to inflate the lungs and keep the alveoli open. The third type of alveolar cells are alveolar macrophages, or dust cells. These macrophages are freely wandering phagocytic cells that are not anatomically part of the alveolar wall, but are found moving on the surface of the alveolar wall. Alveoli are surrounded by a rich capillary network that is fed by the pulmonary arteries. So, how does gas exchange work throughout the body, and specifically in the alveoli? Here are a couple principles to keep in mind. 1. Aerobic tissue metabolism requires oxygen and produces carbon dioxide. And 2. The movement of oxygen and carbon dioxide is accomplished by diffusion. These gases diffuse down their concentration gradient, from high to low, be it within the lungs or within the peripheral tissues. Now, let's take a closer look at how oxygen and carbon dioxide move throughout the body. Air within the alveoli of the lungs is high in oxygen content and low in carbon dioxide content. This air supplies the surrounding capillaries with oxygen, which is then delivered throughout the body through the cardiovascular system. Systemic capillaries entering the peripheral tissues are high in oxygen content and low in carbon dioxide content. Active, metabolizing peripheral tissues use oxygen and produce carbon dioxide. Remember, these gases move down their concentration gradients, causing oxygen to diffuse from the capillaries into the peripheral tissues, while carbon dioxide diffuses from the peripheral tissues into the capillaries. This deoxygenated blood now returns from the periphery back to the lungs by way of the pulmonary arteries. Therefore, the blood within the pulmonary arteries is low in oxygen content and high in carbon dioxide content. Again, these gases move down their concentration gradients, so here oxygen diffuses from the alveoli into the pulmonary capillaries, while carbon dioxide diffuses from the alveolar capillaries into the alveoli. What happens when this elaborate process of gas exchange is hindered? Let's take a look at the symptoms, causes, and treatment for emphysema, and then give a patient example. Symptoms of emphysema are all associated with the essential functions of the alveoli, and therefore of the ability for oxygen to be exchanged adequately. The primary symptom of emphysema is shortness of breath, but you may also experience coughing and wheezing, high mucus production, lips or fingernails turning blue or gray during physical activity, lack of mental alertness. Symptoms of emphysema often begin gradually, but increase to the point of disrupting daily activities. In later stages, emphysema causes shortness of breath even at rest and can contribute to greater health issues such as sleep problems, heart problems, anxiety, and depression. Emphysema is a pulmonary pathology that results from damage to the alveoli within the lungs. Over time, the damage to the pneumocyte type 1 cells weakens the alveolar walls, which increases the surface tension within the alveoli and may cause the alveolar walls to rupture. These ruptures produce larger air spaces within the lungs in place of the normal, smaller alveoli. More spaces in the lungs means less surface area for gas exchange to occur, ultimately reducing the amount of oxygen and increasing the amount of carbon dioxide within the cardiovascular system. The risk of developing emphysema is increased for individuals who smoke or are exposed to secondhand smoke, air pollution, or occupational chemical fumes and dust. A doctor may use multiple methods to diagnose emphysema. CT scans of the patient's lungs may be taken so that the internal anatomy can be examined. Blood tests can determine arterial oxygen levels, and lung function tests utilizing a spirometer can measure the volume of the air that the patient is able to inhale and exhale. To treat emphysema, a doctor will first recommend decreasing or stopping high-risk activity such as smoking or exposing oneself to other air pollutants. The use of bronchodilators and inhaled steroids may be recommended to increase the passage of air into and out of the lungs. Respiratory therapy can teach a patient breathing techniques to help him or her resist increasing breathlessness, and a dietary plan for weight loss or maintenance may also be recommended. In extreme cases of emphysema, supplemental oxygen 24 hours a day will be prescribed. In the most extreme cases, surgery, including a lung transplant, may be required. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 60. Sex, male. Chief complaints, shortness of breath. You invite the patient into your office for an examination. Your patient experiences daily shortness of breath, which he says increases when he does physical activity, like playing with his grandson or gardening. He has also noticed feeling mentally foggy more often in the past 6 months or so, and wonders if this could be related. You ask your patient about his history of smoking, and he tells you that he has smoked cigars regularly for the past 20 years. You decide to begin by testing your patient's lung function and use a spirometer to do so. You observe that your patient isn't able to inhale or exhale as much air as he should, so you order a CT scan to further evaluate the health of his lungs. You determine that some of the alveoli have been damaged and diagnose the patient with emphysema. You talk to your patient about his smoking and strongly recommend that he quit. You prescribe an inhaled steroid for the patient to use to increase airflow within the lungs. This has been a classic example of emphysema. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.